You are listening to SoHeavenly Radio, your favorite Christian media network.
Welcome, guys, to another exciting episode of Health Wednesdays. And today we're going to be dealing with a very sensitive topic. And we have brought along the big guns to come and help us dissect today's topic. So today on the platform, we have with us Dr. Dikole, a dental surgeon with more than 10 years of clinical experience. So he knows the man knows what he is talking about. Dr. Dikole, we welcome you, sir.
No, thank you. Thank you so much. It's just a great pleasure to be part of this conversation today. Thank you. Thank you for the honor and the opportunity. Thank you so much.
Well, the pleasure is all ours. Today we're going to be dealing with the topic, as I said, that is very sensitive. Somebody said, if ever you are late for work, just tell your boss that you had diarrhea. That it's so embarrassing, your boss will not ask you any further questions. So today we are going to be talking about bad breath. And I think it's a topic that we don't talk a lot about. And Doc, as we jump in, some people are aware and some people might not be aware. How do we make people aware of the condition without it being offensive?
Yes, no, thank you. Thank you so much for that wonderful question. Let me just first start by defining. Like bad breath, as we commonly know, but scientifically is called halitosis. Bad breath is commonly known as halitosis. So halitosis is an offense. If I can start by defining it, it's an offensive odor emanating from the mouth, and like any offensive odor or any offensive smell that comes from the mouth, that's called a bad breath. And then at least 50% of the population is to believed to suffer from bad breath. Can you imagine? If maybe we are like 2 million people, about 1 million approximately suffers from bad breath. So you can imagine how that amount of people. So it's something that of what you call public health concern. So imagine like maybe 500 people out of 1 million having a bad breath. Because also it's something that is, yeah. So let me just go to the elaborate further on the causes of bad breath. Bad breath is caused by number of factors actually, but the most common one is the microbial, like those microbes and food debris.
You're audible.
Like what you call microbes or food debris in the oral cavity. What happens, like if you are eating food, the food will get trapped between, there's what you call gingival spaces, like and then the teeth. So also the food can trap on the tongue, like on the bottom of the tongue. There was you call some papillae. They are small finger-like projections, like grass. So the microbes and the food can also pack there, and then if they are not removed, they can produce some odor or some bad smell. Also, there's what we call dental caries. Dental caries is where the teeth are rotting and they form a cavity inside it. So sometimes when you are having a cavity, the food can come lodged there, and then if they are not removed, they will rot, and then they produce that foul smell. And that foul smell, apparently, what happens, like, because the the bacteria will act on those, like if the food is there, the bacteria will act on it, and then it will produce those gases. One of the gases is the hydrogen sulfide, and then those gases, they're the one that we call bad breath or halitosis. But there's what we call physiological causes of bad breath. Physiological meaning is something that is it's not pathological. It's something that is due to the process, the bodily processes. Again, there's what you call the morning breath.
Yes.
Like literally, what happens is, like, when you woke up in the before you brush your teeth, there's that breath that comes from it. That breath, that bad breath, because you are waking up in the morning. As you know, in our mouth we have the saliva. So the saliva is the one that is cleansing or cleaning the mouth regularly, like flushing. It's always flushing. Anything that you're eating, it just flush, it cleans. And then when you are sleeping now, when you go to sleep, like right now I'm talking, my salivary glands are very active, so they're actually secreting saliva frequently, so that anything can get flushed even when I'm eating. Or the salivary glands, they're always producing saliva. Well, so when I'm eating, they're always producing saliva, so that the food can mix with saliva, and then so that it can aid in what you call digestion. So, but when you are sleeping now, when you sleep, the salivary activity, what do you call the salivary activity, it goes down, because now you are sleeping again. So if you have any debris or any food particles that is lodged between your teeth, and then you are going to sleep, which means the flushing mechanism of the saliva, which means the flushing mechanism.
Yes.
Okay. So which means the the flushing mechanism of the saliva, that clenching, because when you go to sleep, it will decrease. So which means now, if you have any stagnation of any food debris or food particles, they won't be rinsed enough as when you are awake. So they will rot. The bacteria will start acting on them, and then they will rot. And then in the morning, when you woke up, because all that process of rotting, because of this decreased salivary gland or the flushing, whatever that was not cleaned, it will produce the bacteria will act on it, and then it produce some smell. That is commonly known as the morning breath. Before you go to clean your physiological. Yeah, that everyone experiences that. It's not when you experience that, it doesn't mean that you are suffering from any disease. Yeah. So so that's why it's advisable, like before you sleep, you advise everyone that they should brush their teeth, so that when you wake up in the morning, you don't experience this morning breath that is physiological. Okay.
Yes.
And then
Anyway.
there's this bad breath that normally occurs because you are aging, because of age. Like like the more you get older, the more your mouth, even when you brush, it produces a certain smell. Like when you, like, mostly like the old people, like when you go home and then you greet them, you can feel that, no, there's a certain smell coming from granny. So there's the moment you age, because the flushing mechanism is the salivary gland. That's where the water comes from. that is cleansing the mouth. So the moment you age, the salivary glands activity, it decreases. So which means any food that you have, or maybe the cleansing mechanisms, because it's now decreased. The moment you age or you get older, chance of you having that breath, what we call halitosis, is high, especially when your hygiene is not is a little bit compromised. And then other causes,
Yes.
like tobacco smokers, like you can have a bad breath because you are smoking. You are smoking like cigarettes, tobacco. Yes, like the people who are smoking, literally, they have a certain. They don't just, their mouth doesn't just smell normal like any other person out there. So smoking, tobacco, some people are doing sniff, they're putting it in the mouth. So you'll have a certain smell coming from your mouth because you are smoking. All right. And then
Wow.
you can have a certain smell in the mouth because of the certain food that you are eating. Yeah. You can have a certain breath coming, or a certain odor that is coming from your mouth because of the certain food that you are eating. For example, like if you can eat garlic, if you eat garlic, you automatically you have a certain smell that is coming from your mouth. I don't know which other foods are you thinking as well. And I'm thinking also of alcohol. I'm thinking of an alcohol as well. People who drink, they start smelling different. So you can have a certain smell because of like the kind of food that you are eating. As long as you can clean your mouth after that, it's okay. And also, there are certain drugs that, like when you take them, they can also lead to production of maybe of a bad smell coming from your mouth. Those drugs are the ones that reduce saliva in the mouth. Are
these illegal or legal drugs?
No, just legal drugs like antihypertensives.
Okay.
Any drug that you reduce production of saliva in the mouth, that make you dry, like diuretics. So agree. We know that the secret is for the mouth to be cleansed. To always be, there should be the flushing mechanism from the saliva. So any drug that have an effect on the salivary glands, it will lead to lower production of saliva in the mouth. And then when there's a lower production of saliva in the mouth, that rinsing and cleansing mechanism decreases. And then whatever that is there that could have been rinsed by the saliva, it will rot and produce some certain smell. Are we together? Are we getting learned about the halitosis?
Yeah. Yeah.
And then there's this interesting one.
I'm learning a lot, and a lot is just being revealed. Because sometimes I think because we don't have understanding, we don't know how to handle certain things better. I think the one that has now just stood out to me is just the fact that even age, that because of the flushing mechanism that you have now just mentioned as well, that because of age, things are are being affected. So now you are starting to experience other things that you you didn't have before. So that one is quite. I didn't know about that one, and that also, I think the main one is that 50% of us, that's half of the population. So between the two of us, somebody is not well. So it's such a high number that 50% of the population are going through this. And some, I'm sure, don't know how or why, what the reason is. And you have just listed the microbial activity that is going on, the food, the smoking, the alcohol that is there. So, yeah, those are really good insights. And I'm sure to you guys as well who are watching and who are listening, please, let's have that conversation and let's share information. Technical takeaway. Okay. I guess the most important thing there is that the flushing mechanism is very key. And if it's affected, then everything else will now just start to spiral out of control. So I wanted to ask, but I think you have already touched on it, that I wanted to, the medical conditions that can lead to chronic bad breath.
Yeah, I think there's also there are certain conditions that, like, the patient would automatically have a bad breath, maybe at even at some distance, huh? Like oral cancer. Have you seen someone with oral cancer before?
Okay. I've never seen anybody with oral cancer.
Yes, it's not a good
I've studied it, but I haven't seen anyone.
Yeah. Yeah, I've seen a lot of patients I've actually treated a lot of patients with oral cancer. So oral cancer, because if you know how deadly the cancer is, it doesn't matter whether it's in the mouth or it's in the breast or whatever. So because of these patients, the way the cancer is spreading can spread so fast, and then also, especially in the mouth, sometimes they realize it late, and because of the infection, there's sometimes it's a big wound that is not healing. So even to maintain the hygiene of it, so a patient with cancer, even from a distance of maybe 5 meters, you can feel that no, there's a certain smell that is not right around because of their condition. And also, there's diabetes. Someone who's diabetic, like they smell like more like sugary. There's a certain smell. If you get closer to them, because they are diabetic, I don't know, maybe, I'm not sure, maybe someone who's not controlled with diabetic, they have that smell that is unique about them as well, coming from the mouth. And also, before we get a challenge with the network, I was to elaborate on this one. That is very, very interesting about halitosis.
Yes.
What he called psychogenic halitosis. Psychogenic halitosis is where it's actually a psychiatric disorder. Mostly it's one of the indicators for psychosis, mostly schizophrenia. So what happens, like, the person will always think what you call imaginary halitosis. The person will always think that, hey, I have a very serious bad breath coming from me, and it's like it's a gas that is coming from all the stomach and it's going out.
Yes. I never knew that existed, and I'm glad that these things are coming to light and people will now be able. There's a saying that if you know better, you then do better. What are some? You've already mentioned brushing your teeth before going to bed, rinsing. Are there any other measures that people can implement in order to to avoid bad breath? And are there any home remedies that are effective in combating bad breath as well?
About to go to the prevention of maybe or halitosis, and maybe when you have to try to explain, like when you have halitosis, like what should you do? uh the
Yes.
most common, like I was just explaining different causes of halitosis, but the the most common
Yes.
causes of halitosis is inadequate oral hygiene, like where where's the standard of the oral hygiene or the caring of the mouth is not to standard. Like when you eat, you don't brush your teeth accordingly, and then there's what the formation of plaque going to your gums, and then it rots. Those bacteria, they produce some gas, and then that's the most common one, the overgrowth of the bacteria in the mouth, and then it results because of the
Yes.
poor hygiene, and then it results in the bad breath. But to prevent I will talk about what you call the good oral hygiene, like practices, like what should you do adequately to prevent this bad breath or
Yes.
halitosis. Ideally, we advise people to brush their teeth twice, like in the morning and then just before you sleep. And then when you brush your teeth as well, there's a technique that you use. You don't, and then the time as well, to make sure that you adequately prevent this bad breath. So you brush, like you have to you brush your teeth looking in front of the mirror, and you have to spend 3 to 5 minutes brushing your teeth, which most of us don't do that. Mostly you just be hurry for work, huh? Just be hurry for work. 1 minute you are done, but that's not adequate. So you have to brush your teeth like in the morning, and in the after, like twice a day. And there's a certain brush that you have to use to adequately remove the food debris or the plaque or anything. You have to use a soft toothbrush, not a hard one. Agree? I was about to like the most important point that most people are missing. The most important thing, like
Okay, you can continue.
you must make it a routine to visit your dentist every 6 months. Like you have to go to a dentist twice a year, whether you have bad breath or not have bad breath, because um the those 6 months checkups, you don't go only there when there's pain. No, your gums can bleed while there's no pain, but it shows that there's gum disease that is happening. Your teeth can start rotting while there's no pain. So those 6 months checkups are very important, because you are preaching like prevention and prevention and prevention. Even halitosis, like because the halitosis or bad breath, when it's advanced now, it affects someone's self-esteem. Imagine when even in partners, imagine when your partner now is smelling, have a bad breath, it's going to affect that relationships. It affects people confidence. So you don't have to wait. Just you have to go to a dentist twice every 6 months. It doesn't have to only when you go there when you know I have a bad breath and whatever. And also the other major things that could help a lot about bad breath is mouthwash. Sometimes the mouthwash, you can use different form of mouthwash. We have Listerine, we have Adolex mouthwash. They can help as well. And also the cleaning. That 6 months cleaning is very, very important, because there's this what do you call calculus is that is attached to the teeth, that when you are brushing your teeth home, you cannot remove it. So that can attach
Yes.
plaque and cause bad breath. So that's why you need to go to that 6 months the dental checkup to remove that, so that you prevent bad breath. Those 6 months are very, very, very important.
Wow.
Mm.
And I think it's also, we ignore our teeth. I think if there is one, our oral health is one of the most ignored aspects in our bodies that we do not really are proactive in preventing. So as you were saying, the importance of taking these preventive measures by going to the dentist every 6 months, that we will wait for things to go wrong, and then that's where now I'm making an appointment with my dentist, which is unfortunate because it means now the damage has already started now, but I had an
Yes,
opportunity to prevent it.
yes. And also the one important thing that I want to highlight as well.
Yeah.
You find that the mouth is not there, and then the body is not there. Actually, the mouth and the body is connected. And there's some other diseases that we normally, when the patient just come in and then we just open the mouth, we can pick them early before they cause any more harm into the body. And because there's a strong connection between heart problems and the mouth as well. There's someone with have a maybe bad breath and then dirty mouth. There's a high chance that maybe they might be having heart disease as well. So the mouth, the health of the mouth. Like, I was just saying that there's a strong correlation between the health of the mouth and the health of the body. What happens is, like, I can just look into your mouth and it can tell me how healthy, how conscious are you with your health, because there's a strong correlation between the oral health and the general health of the body, especially heart problems. Like mostly people with gum disease who have neglected their mouth, there's a high chance of them having heart problems and diabetes. So when you start taking care of your mouth, you're actually taking care of the overall health body, because the mouth is not there and the body is not there. It's only one body.
Yeah. They are all connected. We have learned a lot today, and we'd like to say a big thank you to Dr. Dikole for making time and teaching us, and hope that you guys, it's not just information that you guys receive, but you also implement it as well. As we always say, that we are here to become good stewards of our body. So we have to steward these bodies well. And our oral health is important and is key, as the doctor was just telling us now, that everything is connected, that it's all one body. So we need to also pay attention to our oral health. So, Dr. Dikole, your last words as we land.
No, I just want to thank you for just to give me this opportunity to educate our people, and then just to bring awareness of the oral health. So I'm just pleading for everyone that we cannot be accountable of ignorance and saying, no, I didn't know. So let's take responsibility of our own health.
Yes. Thank you, Doc. We appreciate you, and we appreciate you making time for us and for our listeners. Thank you, guys. Hope you guys have fully informed, and you will take this information and run with it. I like it that the doctor said we shouldn't, in essence, celebrate our ignorance, that we are here now to take away or to break that information deficit. So yeah, thank you guys for tuning in, and thank you to the good doctor.
If you like this content, encourage us by liking, sharing, and subscribing.